Good evening, everyone. Thank you for joining this webinar today. I'm Alka Gupta, and I will moderate this webinar for you. You are being muted upon your entry, and we will take your questions towards the end. If you want to ask a question, kindly click on raise hand, and we will unmute you. We are also live streaming this webinar on Facebook. I'm glad to introduce and welcome our guest speaker for today's session, Dr. Shobyasachi Roy. Dr. Roy is a consultant physician, cardiologist, and diabetologist with more than 20 years of experience. He is actively involved in the COVID-19 vaccination process run by the State Health Department. But before that, I would like to hand over to Mr. Jayanto Sen, Chief Operating Officer, Tribeca Care, to say a few words. Welcome, Jayanto.
Hello. Good evening, everybody. We are happy to see you here to join this webinar. I will not say much about this. You are aware that Tribeca Care is Eastern India's largest elder care company. We have started our journey about 7.5 years back, and throughout this period, we have served hundreds of families in and around Kolkata. We have suffered a lot due to this COVID pandemic, and now hopefully this is coming to an end as vaccination has started already all over the country. Vaccination for the senior citizens, general people will start also in the next month. Our guest speaker, Dr. Shobyasachi, will inform you how this process will go, and you may have a lot of questions about the implications of the vaccination and the process of this vaccination, how this is going to be, how we will be getting the vaccination, what are the process, etc. So with this, I will not say much. I am handing over to Dr. Shobyasachi to carry forward. Thank you, everybody, again.
Thanks, Mr. Jayanto. Hearty welcome to everyone. Respect to my elderly citizens who are present over here. They are more than parents to me. I feel myself honored to say something on behalf of Tribeca. So I'll be going through some of the slides showing that how COVID-19 pandemic has changed the world in the year 2020. So Alka will be sharing some slides through which I will be going. So everybody knows what is COVID-19 by this time and what are the effects of it. As we all know, some brief introduction regarding the COVID-19. It was named as a coronavirus disease in the year 2019, COVID-19. Was renamed by International Committee of Taxonomy of Virus. The structure of the envelope is already been shown. It is mainly a mRNA protein virus. Next slide, please. This slide shows the pathogenesis of COVID. How the cross-infection occurs and harms the human population. It is also termed as a zoonotic disease as because it is carried forward from animals to human beings. And the transmission is being showed in the slide. Next slide, please. Alga, next slide, please. So SARS-CoV-2, it is the taxonomic name of COVID-19, as pathogenically and genomically similar to SARS, like bat SARS, COVID-19, coronavirus. The primary host is a bat, and the consuming which the human consumes, and direct contact comes in direct contact. Human is the direct host, and human transmit the disease from one to another. Next slide, please. Now, this is the molecular level of transmission of COVID-19, how the protein level breaks down and it combines to the ACE2 inhibitor and TMPRSS2 proteins. So we'll not go into details regarding this. I'm just showing some of the slides. Next slide, please. Now, these are the effect of SARS-CoV-2 in different organs. In gut, in brain, in liver, in kidney, skin, cardiovascular system, lungs, and eyes. You can detail this detailed over here the various pathogenic effects of this virus. In brain, we see acute CVA, brain inflammation, encephalitis, seizure, ataxia, impaired consciousness and dizziness, headache, skeletal muscle injury, loss of smell, taste, and visual impairment. In liver, we see 15 to 35% cases shows intensive hepatic damage. In kidney, we see acute kidney damage leading to hematuria, albuminuria, and proteinuria, high blood urea and nitrogen levels, as well as high increased creatinine levels. In gut, we see esophageal bleeding, hemorrhagic colitis, colon damage. And in eyes, we see the increased secretions. Mainly the most infected organ is the lungs, which comes up with pneumonia, alveoli, choke, and leading to the dead lung cells and mucus fluids. Cardiologically, we see the cardiac muscles impairment and multiple organ damage is also been seen. Next slide, please. Now coming to the main portion, the remedy of it is the vaccination. It is always prevention is better than cure. So the mega vaccination drive has begun in India from January 16th, 2021. Now it has over 94 lakh healthcare workers and frontline workers are inoculated so far. And next slide. The two vaccines which has come up into the market for the frontline workers and the healthcare workers are the Covishield, which is marketed by the Serum Institute of India, and Covaxin by Bharat Biotech. The two doses at an interval of 28 days needs to be taken to complete the total vaccination process. Next slide. Now, coming to the point, who is eligible? Right now, we the healthcare workers who have and the frontline workers and the population more than 18 years of age, and the seniors more than 50 years of age and below 50 years of age with comorbidities like diabetes, hypertension, etc. These are all categorized as high risk individuals. And who is not eligible? You come in, if you see in the non-eligible group, it belongs to the pregnant and the lactating woman, and the one who has some allergic reactions to the dose of COVID-19 and also suffering from some kind of medical illness. Next slide. Now coming to the point, see, anyone with a history of allergies, having high fever, having bleeding disorder, or a blood thinner, immunocompromised or on medication that affects your immune system, have received another dose of COVID-19, or any other serious health related issues as determined by the vaccinator, vaccinating officer, or the supervising vaccination. Next slide. Now coming to what is the structure. COVID-19 is an mRNA vaccine. There, the vaccine structure is an mRNA, which is given in the upper arm, deltoid. Mainly the deltoid muscle is selected because it is the fleshiest part. And the arm cells use the vaccine molecules to make the protein piece. And our immune system recognize the protein piece and make those antibodies against those protein piece. These antibodies formed are boost our immunity against the virus. Next slide. You can see the picture. It is designating well that how to take the vaccine. Now, how to register? So, as this vaccine is very much coveted vaccine, much wanted vaccine. So this vaccine is not readily marketed till date. It is only for the frontline workers and the healthcare workers till date. So how the workers are being vaccinated? They are being vaccinated by downloading the Coven app, and they should be registered using the government IDs, using the ID password, date of birth, and address proof. And they should choose the preferred vaccination slot. The time, date, and the place of vaccination should be registered. Next slide. So yeah, I'm very eager to accept some questions from you, from the elderly persons who are very much anxious.
Yeah, thank you, doctor. Thank you so much for your for enlightening us. There's a small video on registration process that we would like to share.
Okay.
Yeah.
The mega vaccine drive has begun in India from January 16th, 2021, after the approval of Covishield and Covaxin. The vaccine will be available only upon registration. There is no provision for on-the-spot registration yet. Let's see how can you register for COVID-19 vaccine. Step 1. Download Coven App. The COVID-19 vaccine will only be available to those who have pre-registered on the Coven website or app. So download Coven on your smartphones from your app store, or you can go directly to www.coven.gov.in. Coven, or COVID-19 Vaccine Intelligence Network, is an upgraded version of the Electronic Vaccine Intelligence Network, EVIN, used by Health Ministry to track the vaccination drive. Step 2. Signing up. Complete the sign-up process by uploading your documents for self-registration, including election ID, Aadhaar card, driving license, passport, and pension documents, etc. Step 3. Authentication. In case you choose to provide Aadhaar card as photo ID, the Coven system will perform an Aadhaar authentication. You can select from a range of authentication methods listed, namely biometric, OTP authentication, or demographic authentication. This is important as the same verification process is required at the time of vaccination as well. Step 4. Applying for the vaccination. You will find 5 modules in the app, namely Administrator module, Registration module, Vaccination module, Beneficiary acknowledgement module, and Report module. Select the Registration module and request for the vaccination with the necessary details. Step 5. Processing your request. After your request has been processed, you will receive your date, place, and time of vaccination on your registered mobile number. Starting with healthcare and other frontline workers, the vaccine will be available to those above 50 years of age who are suffering from multiple diseases, and finally, the remaining population. Coven app will be shortly available for free on your app store. So register and verify yourself using the app as you wait for your turn for the vaccination process to avoid any complications and delays later.
Thank you, everyone. I hope I know you have many queries regarding this vaccination process, and we would like to take your questions one by one. So if you have any question, please unmute yourself and ask the question to our,
So
Mr.
I wanted to ask, so it is totally app dependent. So there are lots of elderly people who will not be able to do this. So is there a solution? So this seems unfair on people who are not going to be able to download apps or register these things.
Right.
How are we going to register these people?
See, if you are registered on the Tribeca, means as because you are attending this, shall I answer? Well, try with your
Yeah,
due
sure, please,
permission.
doctor. Go ahead.
Yeah.
Please.
This I hope that you are all are a member of a Tribeca, or you are following the Tribeca. Means on their part, as because the frontline workers and the healthcare workers are now being vaccinated in the first phase. This is the first phase going on, and the second phase has already been started from 20th. Okay, so the second dose is also given. Completing the when the is still on the second, third trial, means in the clinical trials. It is now not all till date. It is not out of in the market. So you will get this vaccine by registering yourself in the Mayo Clinic in Chetla. The registration process
But you
manually.
have to be registered, you have to be living in Chetla to access that clinic. I have tried. And people who don't live in Chetla cannot access that clinic.
That
Shall
is
I
a
add something?
yeah, that is also an issue.
Please join the
Till
So
date,
Please
have
add
the
some.
government thought about how these issues are going to be resolved? Because the vulnerable population, yet if they don't know how to use the smartphone, that is so unfair on them.
Yes, so I would like to
So,
ask is what kind of help will Tribeca give to help the downloading of the app for people who are not able to do that, and also how and help with registration for our elderly relatives who are living in Kolkata who cannot do this on their own. I want assurance that Tribeca will go to each and every one of your clients to help with registration, downloading the app, and helping them understand how to actually get the vaccination. And to Dr. Roy, I just had a question. Neither the AstraZeneca, Covishield, or the COVAX vaccine are mRNA vaccines, actually. So I would like to know if two questions. One is India planning to get either of the Pfizer or Moderna vaccine? And if not, how effective is the AstraZeneca or the one that's manufactured by Bharat? How effective is it for people above 65 with comorbidities?
see, according to the studies, the vaccines you told right now, the AstraZeneca and the Moderna, is being carried out in USA. But here in India, we have started the two vaccines. The government of India has started the two vaccines, and they are claiming to be equally potent with those with the Pfizer and the Moderna. If coming to the effectiveness, if I say something about it, as because during the aging process, what happens is the CD4 count is to CD8 count. Is the immunity, regarding the molecular level, I'm telling, the immunity power of the elderly is a bit reduced because the CD4 count is to CD8 count, cluster differentiation is bit raised, and the attenuation power and the process of immunity is bit lower in cases of the elderly. So the vaccine is likely to be less effective in the elderly, which is probably much more effective in the younger and the adolescents.
But that's fine. But that is fine. Excuse me. That is fine. But I just want to find out how safe will it be for people with comorbidity?
Can I ask? Can I mention something?
If I may interject a little bit,
can I mention something, please?
And essentially, you said just now that the third phase trial that says AstraZeneca is at the same level at the Moderna and the Pfizer vaccine, I don't think that data is supporting that. There's no way that the AstraZeneca is at the same 94 to 95% efficacy rate. I mean, I don't know of the data published about the Indian vaccine, but definitely the AstraZeneca is
till now, all the data are being very filthy. Means actually you cannot rely upon. Actually, still now the vaccination is on process.
So let me. Can I just mention something? Can I just
may I just have a,
can I? Oh my God! Can I just mention something? I'm calling from UK.
but
I'm calling from UK. I'm calling from UK, and I'm part of the vaccine task force in the UK government. Can I mention something about the scientific questions? And then I want to ask some practical questions, please. Can anybody hear me?
Sure, sure. Please,
Yes, go ahead.
Okay, my name is Professor Basu. I'm one of the vaccine task force in the UK government from NIHR. And I'm interested in this because my mother-in-law is a Tribeca customer in Calcutta. Okay, so my suggestion to all of you is this: rather than asking the efficacy of the vaccines, Moderna mRNA platform adenovirus vaccine, we can go into at length about the scientific questions. The problem is in India, Pfizer vaccines is not going to be available. I can tell you this. So you have to concentrate what is available and let's deal and get on with it. Okay, it's no use asking how much effective, how much ineffective that is. It doesn't make any sense because you're not going to get it there. There are only two vaccines available in India. One is the Covishield, which is the AstraZeneca clone from the UK government. And Covaxin is the Indian government vaccine, which is an attenuated virus vaccine. And the phase 3 trial has not been reported on that. But let's forget about this because the data will come out eventually. And you have to go by what is available locally in India. So it's no point asking how effective this is, how ineffective this is. This is what you have got, and you have to get on with it. If you ask me about the AstraZeneca vaccine, it is as effective as the Johnson & Johnson vaccine because the platform is the same. It is a adenovirus vector vaccine, and Johnson & Johnson vaccine is 85% effective, even across the Brazilian and the South American strain. So I think the AstraZeneca vaccine is as good as it gets, and please get on with it in India, what you have got left. My question to Tribeca for the practical reason, which is much more important than asking about the scientific merit and demerits of the vaccine. That is, how are you going to make sure that these elderly people are going to get the access to the vaccine through this complicated smart app and app store business?
Exactly.
Is the Tribeca going to guarantee us that somebody who looks after these vulnerable people, they're going to help them to get registered and make sure they get vaccinated in time? That's what I really want to understand. I'm not interested in the vaccine efficacy.
Thank you. This is a very good question.
Absolutely.
Can I take that answer, please? So my name is Pradeep Sen. Can you see me or hear me?
Yeah.
Yes.
Okay. So my name is Pradeep Sen. I'm one of the directors of Tribeca. And I was actually going to sort of echo what the professor was going to say, right? So in India, there are two vaccines that people are talking about, which is one is the Oxford one and the other one is the Indian one. Now, we don't know which vaccine is going to come out at what time, right? So obviously, when it does come out, we will, and if there's a choice, we'll come to you and ask you, what would you want? And at that time, you know, the efficacy and all of those things will probably come into play. On the assumption that there is only one vaccine that's happening, what we will, and this is, I'm saying that it's a guarantee, but it is our best effort. What we'll make sure is that, and that's what we've already started, is to make sure that our care managers, one by one, we'll actually go one by one for each and every member that we manage and make sure that they get registered under the Coven app, right? Once you do that, and at the same time, what we are also doing, and John Tada would have been talking about it, we are also talking to certain government officials to make sure that if a person can't really come down, or if there is a center that we can take them to, how do we actually make that entire process simple? That's what we are working on. But what we are really taking on over the next 2 months is to make sure that people get registered. And then depending upon the location, depending upon what is available, we will either get the person home or take the elderly to the center that they have. So that is going to be one of the very big jobs that we'll do over the next couple of months, 2-3 months. And we will keep you informed. And you would have already seen probably a newsletter which we sent out, maybe 1 or 2. What we'll do is we want to make sure that we keep you apprised of what's happening so that there is no doubt what's happening, right?
Okay, so can I just ask in summary, so at the moment, if you can't download the app, if the elderly parents who are living in India can't download the app, they can't get the vaccine unless Tribeca helps them. Am I right in summarizing this?
That's right, right? So we or someone else, we will make sure that that person does get registered. Once we know that people are getting registered, we will make sure one by one, we'll actually go down and make sure that all of our clients are actually registered on that.
Okay. Can I ask, what is the timeline for that? What is the timeline when the Coven app is expected to be available?
So see what's happening is, so let me also take that, right? So there are links which have been provided about what the app is going to be and when it's going to come out. We look at it almost every day. We try to figure out with the government officials what's going to happen. But as the good doctor said, right now it is the doctors who are getting on it. After that, it's going to be the healthcare, the workers, including the police and so on. And after that, the elderly will happen, right? But we are really, every few hours we check to make sure that's happening. And once that happens, we'll sort of spread it amongst our own people who will spread it amongst our members.
So connected with that, I have a question. So when it opens finally, will it be a first register, first serve method? I mean, should there be a rush? Then will there be a rush for registration?
So let me again on that one, right? So right now there are different people having different opinions. There are people in WhatsApp who are giving, the University of WhatsApp news about what's going to happen. But my answer to you is that I think no one really knows, right? When that happens, we will understand what's going to happen, right? And we'll make sure that it happens in an orderly manner, and we're not really,
And this Chetla thing is also quite confusing, This Chetla, what's happening at Chetla, we know.
Let me explain to you the Chetla thing, right?
Right.
So the Chetla one is actually, and I'm being very honest out here, the Chetla one is a clinic that it is probably in the same vicinity as where the mayor of Calcutta lives, right? So in his clinic, he's allowing some people to register. They're actually registering with a pen and paper on a khata, on a book, right? Now, what we also think is that that's going to happen is that at some point, those will get transferred over to the Coven app, because what everyone is saying is that the Coven app is the most important, that's where is the truth, correct? So while everyone is talking about the Chetla one, and there are talks about whether we can get 2 people in or 5 people in or 20 people in, all of that, it is still a very, very manual process, and no one has yet really got vaccinated, or very few probably would have got vaccinated from it. So instead of just going into the Chetla stuff and trying to, sort of like a herd mentality moving out there, let's wait a little more. And I think that these things will just flow down in the right way over the next couple of weeks.
I have got a question, sir. Can I ask a question?
Yeah.
Okay, my question is twofold. Number one, do you know whether this is going to be privately available in India? Because that will solve a lot of problem if it is.
I'll tell you what we know, right? So we know that the private hospitals are gearing up for providing the vaccine, right? So we know that they are actually getting facilities done in which people can come in, get the vaccine done, and so on, right? So there is a little bit of, almost like a wave of things that's happening across infrastructure building across. Now, there is an expectation that the first round will be, the government-led process, but over a period of time, as there are more players who come in, it will become a private one. And in a way, if there is a private one, it's the easier one to sort of manage through and walk in. But again, this is conjecture, right? So,
but that's going to be the private rollout will be independent of the Coven app in that case?
So we really don't know. No. And that's my point, right? I can tell you that this is what I think, but right now, I really don't know. And as we get to know these things, we will keep you apprised. Doctor, do you have a view
regarding the private? I want to say something.
Yeah, doctor,
regarding
please.
The private part, regarding the private, what he asked about, I want to say that government of West Bengal has taken some initiative to provide the vaccines from the cold chain system to the delivery point to some private institutions such as ILS Hospital, Charnock Hospital, in and around. Okay. And in many private organizations, and there the names are being appointed from the local health authorities, which are being sent to the private hospitals or any health centers wherefrom the vaccines will be delivered very diligently to the elderly population just after the completion of the process of the frontline workers. This is the latest news which I can share with you.
Doctor, in your presentation, there was something about prioritization. So people with multiple comorbidities being first ones. So, I mean, what do you think will be the likely prioritization? Is it going to be by age, by kind of multiple comorbidities? How is it going to be handled?
The prioritization is done by the multiple comorbidities first, then by the age. As because the multiple comorbidities person is very much vulnerable population. So you'll select first the multiple comorbidities patient subject, and then after they will come by the age. And the contraindications are also being noted, which according to my personal experience, the vaccine right now, the Covishield and the Covaxin, both are very much safe. When I took the vaccine in the 16th of the January, the main immune reactions which happened to me, I had just fever, which is very much obvious. It can happen or it may not happen. I had to take 2 paracetamols. I had myalgia and I had headache. These are very common symptoms. But regarding the prioritization, I will say, according to the guidelines, it is suggested that the patients with high comorbidities, high risk factors are selected first. And the government of West Bengal is putting enough strain to prioritize it, because they have started a list on putting down the person who has comorbidity list is high. Top to bottom, they are planning out that which person is having how much comorbidity. They will be prioritized based on that.
Were you given a choice between Covaxin and Covishield? Because from the last news articles we saw, you're not being given a choice. Just to correct that.
Doctor, can I just ask a quick question? How would actually the decision be made on, who has a greater comorbidity than someone else, and on what basis would that choice be made, in terms of, will there be an app rolled out or something? Pardon me if I'm ignorant, sitting thousands of kilometers away, but it's something that I'm concerned of for family members who are comorbid in a way. And given the time constraint, I'll also ask my second question. What's the time frame for the privatization rollout, if you have any information at this stage? Thank you.
Regarding the time frame, coming to the second point, this has not yet been decided. Regarding the first point, what you asked, that prioritization, the government of West Bengal has already been started working on it. They are prioritizing patients who had frequent visits of hospitalization, who has multiple comorbidities. They are taking the data from the municipalities, also from the block levels and the municipalities level.
Could I ask a question, please?
Yeah, please.
Yeah, thank you. This is, I just wanted to know that, Doctor, you were talking about people who are having blood thinner medicines as like they will not be allowed. Am I wrong in interpreting that?
No, actually, they will not be allowed in that sense. In my hospital, I have allowed the patients with blood thinners who are taking aspirin and COVID-12. Okay.
Because I'll just tell you, my father, he's already has his bypass, and he has a he has aspirin. So in that way, do you think he'll be eligible?
I think it's eligible because I have vaccinated in my hospital. I vaccinated more than 50% who are on blood thinners, but they didn't show up with any of the AEFI, means adverse effect following immunization. Nothing has been reported till date. Means in my hospital.
I see.
There are 2 cases reported till date, and they are well. They are surviving. They do not.
Okay. And what about patients with COPD problem?
They're safe as well.
Right. That doesn't fall under the allergy group, right? Who are
safe as well.
They are safe as well. Right. Thank you so much.
Okay. Thank you for explaining about the blood thinners, because I would have said, like, most people in this group and most of our family members have some sort of taking some sort of blood thinner, so that would have eliminated many people. Yeah, thank you for clarifying that.
Unmute করবো না mute করবো?
As because JNC guidelines, Joint National Commission guidelines, has put it on a protocol that when you cross 50 years, you must be on a blood thinners.
Yeah, exactly.
Viscosity of the blood decreases. As because the viscosity of the blood
One question that is coming up, doctor, is whether we have a choice between these vaccines, Covishield or Covaxin. Can we choose between these two?
No, you cannot choose because it is totally being given by the government of West Bengal and the government of India actually. So we do not have a choice. It will be given by them. It is not yet being marketed by the pharma companies till date. So we have no choice.
Okay.
I have a question.
Can I ask a question, please? Can I ask a question, please? Dr. Ron?
Yeah, sure.
To your health worker who are visiting us.
May I get it again?
How are your organization is planning to vaccinate the health worker who are coming and attending the patients?
I said it earlier. The vaccine are being delivered to the private organizations as well. The vaccines are being carried from our cold chain. Our cold chain, hospitals cold chain, the government hospitals cold chain to the delivery point where the vaccines are being delivered very diligently by the healthcare workers. So you need not worry. You are already being enlisted in the Tribeca, so you need not worry about the vaccine. Whenever there will be declaration that the elderly population will get the vaccine, will surely get the vaccine.
No.
And the people, no, I'll take that answer. Yeah, on that one, on the people who work in the homes, what will happen is that they'll have to follow the protocol that the government sets based on age, and on that basis, they would get vaccinated.
And second question is, through this app, the whole family can register, or through the app only one person can be registered? I mean, if I have elderly person, two elderly person, so through one app, both the elderly people will be registered, or through app only one person will be registered?
So again, Jantata, do you have the answer for that, or?
Yeah. So say through a single app, the entire family can be registered. But the thing is that initially the people of the age of 50, above the age of 50 will be registered from a particular family. Okay. So anybody above 50 particular family will get registered first at a time. So another thing I would like to add that even somebody is not having any smartphone or whatever it may be, you need not be worried. Because Ministry of Health, along with the Kolkata Municipal Corporation, Bidhannagar Municipal Corporation, they will be organizing camps at almost at every municipal wards in Kolkata and Bidhannagar, where the registration process will start. So even anybody is not having smartphone or whatever it may be, they can get themselves registered there by sending their authorized representative with Aadhaar card and other documents, and thereafter an SMS will go to their mobile number. Okay, and on that SMS it will be mentioned that when they will have to come to the vaccination center for the date and timing will be mentioned.
So the point.
Quick question here: Can the care manager be that representative who goes there?
Yeah.
And that's what.
Definitely.
Okay, thank you.
Definitely.
So
And Jayanta, can I ask a question? When you mentioned that they will set up these camps for registration,
yes,
but only certain places will be where they're actually administering the vaccines, right? So people, even though they can register maybe in Bidhannagar or somewhere near their home, there's only certain places that actually they will have to go to do the vaccination. Is that correct?
Definitely.
Okay.
But there will be separate dates, separate time slots. Okay, for vaccination.
But do you know where the vaccination centers will be in Kolkata yet?
That they have not yet announced.
Okay.
Can I just add on to that exact question which is being asked right now? So, but would you be able to say, would that be a private facility rather than a public one? Because obviously
That
we're
will
concerned.
Initially, I would say that those will be public facility, but for private facility, there is no announcement yet. Whenever there will be an announcement for private facility, we'll definitely let you know.
But just to add to that, John Dada, I think the public facility, and that's, the few doctors that I've spoken to have already been vaccinated. I think the process is very, very streamlined, right? So waiting times are small, right? So I think the government is doing a good job, even in the public facilities, to get people vaccinated.
Right.
But the vulnerability of a patient, who's comorbid or with ailments on the side going into a public facility, aren't there concerns around that?
Exactly.
So let me tell you that there will not be that much of rush. Whatever you are anticipating that 100 people will be standing in the queue and all that, this is not going to happen, because there will be number of centers this time. Okay.
Okay.
But
thank you.
Nothing can be said until and unless the process starts one. Then we will be come to know. Okay.
Would it be smarter to wait for the nasal vaccine, which needs just one-time use, and therefore you don't need trained people? There's a talk of that from same organization as Bharat Biotech as Covaxin. Is it smarter to wait and for the nasal vaccine? Therefore,
Pradeep Babu, can I make a suggestion?
Yeah, sure.
Okay.
Maybe, just let me just reply to that one and then I'll take it. I think these are the questions I think a lot of you would need to talk to people around you who are thought about these things. And then as we come closer to the time when we do the vaccination, that's the time we can take the call. Saying that
Dr. Roy, I have a question, please. Dr. Roy, I have a question.
I couldn't hear the response because
no, this is regarding food allergy. This is regarding food allergy. If a person is allergic to food, what precautions need to be taken?
Ranjana has already been on drugs for allergy.
What is the arrangement for an elderly person?
Being on drug for allergy, anti-allergic medications. If you are already being on anti-allergic medications, you can safely take the vaccines because you can safely take the vaccines.
Okay.
But if following the vaccine, if you have any adverse allergic reactions, then you should and you must consult your treating doctor, and you must not wait. And you must not wait for the anaphylactic reactions which may occur, and you must rush to a hospital as soon as you see any allergic reactions in your body. That is the only advice which has been given from our health department.
So my
the professor had a question.
Published actually by the West Bengal government or that particular location, and that kind of vaccine distributions in this area for the elderly people. So how this Tribeca operationally is managing this? Usually they are managing some people who are elderly. They may not be able to do by themselves. So how operationally Tribeca, is it to just quickly
No, we didn't catch that. I think we didn't catch the question.
Hello?
Yeah, we didn't catch the question. Can you just repeat it?
When this vaccination date for the particular location is announced, okay? Yes. So obviously means that all old age people or what the prioritized people will be there, they will have to go for the vaccination. So for those who are registered with Tribeca in this location, how the Tribeca is operationally going to manage? Because we need the Tribeca support, right? Because
and that's what we said. Right in the very beginning, we will make sure that we can accompany, your parents or whoever it is that needs to go down, our members, and we'll manage through that process over the next few months.
Okay, fine. So Tribeca will intimate also those people that these are the kind of a timeline and the dates means when this is happening. Okay, perfect.
See, and as just to add to that, no, just 1 second.
Yeah.
See, what we have tried to do is that over the last 2 weeks, we have already sent you 2 emails. We are doing this webinar, and we will do a lot more of these going forward because we just want to make sure that everyone is knows what's happening, right? We don't want it to be a surprise, in a week's time or 2 weeks' time or something like that. So we'll keep everyone informed. We will also send you the names. You already know who your care managers are, but we'll also give you a few other persons that you can contact if you can't get the first person. So what we are trying to do is to make the process a lot more streamlined, a lot easier for you to access people within Tribeca, so that over the next few months, we have a good process to get everyone vaccinated.
Thank you, Mr. Pradeep. One question, follow up on that process, and the process that you mentioned for getting people signed up first. I think, thank you very much. That's really laid in stone. The problem is when they get the notification for when their date is, I'm expecting that to come through a message. And that part again, maybe some of our elderly parents at 84 or 86, they are not able to check their messages regularly.
No, absolutely. And we understand that. And those are the challenges that we'll have to work through. But we hope that we will have answers to all of them at some point, right? To give you an example.
Do you think that maybe registering them through the care managers
and that's the
mobile
point,
app will be a better option?
And that's the point. Should we centrally register them? Should we do it on their phones? I think these are the questions that will come up over the next few weeks, right? And we'll try to do it in a way where the control is a lot more with us than with someone who is 80 or 85 years old.
Thank you so much.
Hello, I have a question. I want to know how do we figure out who will be the doctor who will assist me in case there is a necessity after the vaccination? Are you going to give a support to the small towns? Say I am located in Kharagpur. Do you think I'll get a support of Tribeca?
So right now, our members are in the Greater Calcutta region and in Bhubaneswar. So that is the place where we can provide the support to our members.
Okay.
Right. In Kharagpur, obviously, it's going to be a challenge because we don't have much of an infrastructure out there. Right. But obviously, within the confines of the city and Bhubaneswar, we can absolutely, we will be providing support. And one thing is a good point is to just make sure that there are doctors on call, post that period.
So in that case, I have to choose a doctor who is in the neighborhood.
Yes, you should. You should have your own GP that you would be able to.
So how do I coordinate that? How do I coordinate?
Let me tell you one thing, that whenever you will go to a vaccination center, they will tell you the case of any reaction on adverse things, whom to contact.
Okay, they will have the information. Okay.
Yeah, definitely get the information from the particular vaccination center. Okay.
Okay, thank you. Thank you very much.
I have a question. Can you hear me, Pradeep and Jayanta there?
Yeah.
Yeah, this is Arup from Boston. My question is, two things. One is, I've heard you all, and you said that you're not sure when the Coven website will be open for the next category, which is, the elderly people. So I'm assuming there's no guesstimate there. Is it a month or so? You won't know. So that's the first question. And the second question, I heard the doctor who spoke that you say that there's not been an issue with the internet and registering. Living in Massachusetts, I know it's a big deal here, even in the US. So what confidence do you have that, the websites and all will all work properly, when they're allowed to do so?
You see, in India also, there is some glitches in the Coven app. As we hear that the target for vaccination, whatever is supposed to be achieved, it is around 70%, 75% because of the glitches in the Coven app. But let me tell you, in India, there are a lot of people who are unable to use these smartphones. Okay. So what will happen to them? That's why Ministry of Health, Government of India and West Bengal government, they have decided to get the registration done through the respective municipal corporation. Okay. For which they will be opening the camps, etc., at several places in each and every ward, where the person who wants to get vaccinated or his authorized representative can go with the ID cards and get this registered. But the SMS will come to the person who is going to be vaccinated. In this case also, as somebody was telling during this meeting, that elderly people may not be able to read the SMSs and all these things. So we are also exploring the possibility of mass registration. Okay. And at least I have spoken to 3-4 people already in several places, like I have spoken to NKDA, then Salt Lake, Nizamnagar municipality. For the elderly people, if there can be a mass registration for a big housing complex or a big society, or like a company like Tribeca Care serving more than 1,000 family members. So such things will come, but when it will come, it is very difficult to say. Hopefully, we are available. Then sometime in the month of March, there is registration for the general people will start. Okay, but as soon as these things are available, we'll definitely let you know. But one thing I can assure you that government is very serious about this, and no way this smartphone or this app is going to be a deterrent for anyone.
Thank you very much for everything you're doing.
Can I just mention something?
Yeah, just to add, I think, yeah, just to add to what Jayantada said, I think our effort is to make sure that we have an orderly vaccination process, right? So instead of hurtling towards the first couple of days to get vaccinated, maybe waiting another few days and doing it nicely is what we'll try to do. But just to make sure that, you know, we don't have a process in which everyone is, you know, sort of bottled up and then trying to get it done on day one and day.
Pradeep Babu, I've got a question for you, please. Can I make?
Absolutely.
Okay. My first question, and I've just two comments I will make, then I think very helpful meeting. Number one, all we want to hear, at least personally, me, that my elderly mother-in-law, that whoever is caring for her will make sure that when the time is right for these people to be vaccinated, that they will look after them to make sure things are done properly. That's what I want. And we can discuss about the process, but being abroad, we have no control of how things are going to evolve in Calcutta. So what I'm asking, can you guarantee us that whoever is looking after our elderly relatives, they will make sure that the vaccination actually happens, and it should be part of the Tribeca agenda to make sure these elderly vulnerable people get the vaccine properly in a safe way? That is the first question. And I'm very grateful to have some assurance from you as a care manager. The second thing is that if it does help, I don't know, because as a part of the UK government, we had a letter from the Department of Health from Indian government about all the vaccines and which group they will be vaccinating. I'm not sure. I think you might have got a copy of the letter. If it helps you, I can send it to you. It might be very useful for the part of all the people who are here, if they want to have a look at the official government letter and the policy and all the vaccine and contraindications. There's a big document letter there with me, which we got as part of the UK government because they shared it with us. So if you want to have a copy of the letter, it's a private letter. I can share it to you. It is open now. So if that helps, I'll be very happy to share it with you if it helps. And the third question, somebody mentioned about the nasal vaccines. I will strongly recommend not to wait. Please get vaccinated. By no means wait for something better to come up. Whatever is there now, get yourself vaccinated. That will be my only advice to all of you. Please don't wait for something better to come up in time. You don't know when it's going to come up, if it's going to be successful or not. There's no guarantee. So whatever you've got now, whatever is offered to you, take it.
So very good. So let me actually respond backwards, right? So thank you for point number 3. And I think that's very, very good advice from you. On point number 2, absolutely here, right? Information is important. So if you can share what you already have, that would be wonderful. So please do send it.
I don't know how to share it. I can share it if you. I've got my email. I don't know how to. I can email it to you, the document, if you want to have a look at it.
Yeah, please do that, and we can give you the email where you can send it. On the first point, and that's the point that is the reason for this call also, is that we want to give that assurance to everyone is that while you are not in the city, or if you are an elderly in the city, we will make sure, or we will try our best to make sure that we get all the vaccinations done, and we do it in a way in which we can help the Mashima or Meshomashai take the car, go down there. If it's an Uber, arrange it, take it down there, make sure that the waiting is as little as possible. You know, all of the good stuff that we have done over the last few years, we'll try to make sure that that happens. Now, obviously, as I say, and my mom herself is about 85, right? 85 and arthritis, and she can't stand for too long. So I understand how that happens. But we will do it in a way that there's a chair to sit, and if there isn't a chair to sit, we'll find something to where they can sit down, but do the process in which they can get it done and get back home safe, right? And that's the that is something that we will strive to do over the next few months. So that's the assurance that I can give you, right? Will there be issues? I'm sure there will be, right? And I don't say it in a bad way. The reason is we know that as things happen, there could be, doctors who are supposed to give the vaccination who are not there. Those issues, or the name doesn't appear. There will be always those issues, but our care managers, our people will be there to make sure that we reduce those issues as much as possible.
Thank you very much.
Thank you very much. Very helpful.
So I think it's time we should wind up the webinar. If you have any question, please, we have 5 more minutes. We can cover that.
I have one question.
Hello.
I have one.
I just had a question.
Hello.
I just
Yes,
asked on
Mr.
the chat.
Banerjee. Mr. Banerjee, you want to ask a question?
Mr. Ashit Paul, you want to ask a question, sir?
I tried to register myself by downloading the Coven.
Yes.
It doesn't download.
See, and right now, as I'm saying, right now, there's a lot of flux in the Coven app, right? So let a couple of weeks pass, every minute or a couple of days pass. Let's understand what it is, and we will get back to you.
But your care manager will help me register.
Absolutely. They will.
What is the, hello?
Yes,
Can I
please.
ask you a question?
Yes, please.
What is the arrangement that you will be able to make for a person, an elderly person who is unable to move out of the house?
See, that's one which is an important one. We'll have to see what facilities the government has, right? Till that point, we don't know. So I can't say, but what we are trying to do is to make sure that everyone gets vaccinated.
Okay.
Now, if someone can't move out, we will have to make sure that someone comes out there, but then we will have to work with the government, work with private organizations, and then see how that happens. Till that time, we follow all the protocols that we did during the lockdown and in this period to keep people safe.
Okay. Thank you.
Thank you everyone for joining the webinar. Thank you so much. All your queries, all your suggestions are welcome. You can email us at inquiry@tribecacare.com. You have our care manager's number, you have our central number, you have care coordinator's number. Please reach
Hello.
our suggestions. Yes,
Hello.
sir, please. Yes, sir.
Hello. Good evening to all. At the onset, let me extend my thanks to Tribeca for organizing such a beautiful program. My small question. I am already 78 years old. Besides hypertension, I am suffering from PD, Parkinson's disease. So I am afraid if there is an adverse effect of vaccination on these comorbidities, especially the PD.
So, sir,
on this one, I think the doctor would have been the right person to answer, but he's actually left. What we can do is we can get back to you on this. So, Alka, why don't you just make a note on the gentleman's details?
Yes, sir.
And what we can do is to reply to him later.
I have a follow-up question on adverse risk factors. How does that increase with extreme age? My mother's over 90. Should she avoid the vaccine? What is her risk of adverse reactions?
Well, I don't have the answer. I'm sorry. The doctor would have had the answer, but I think he left a few minutes back. He's not on the call anymore.
I can answer if you permit me to.
Yes,
I'm vaccinated. I'm a doctor in the UK, and we have vaccinated our cohort. So I'm one of the partners in a general practice, group practice, and our vaccination cohort, we have actually finished all our 90-year-old, above 90. And there has been no, as long as you follow guidelines, there's no increased risk of any adverse reactions simply because you're elderly.
Okay,
we would encourage elderly to take the vaccine because you're at a far greater risk of harm from the COVID disease than you are from the vaccine.
Thank you, ma'am.
Nobody has yet died of the COVID vaccine, but lots of people have died of the COVID disease. So that's what you have to see, the risk. And I would encourage every elderly to take the vaccine, please.
I completely agree with you.
Thank you, doctors.
Thank you, ma'am. So with
thank
this,
you again.
Thank you everyone. We will end the webinar now. You can ask your questions, you can email us, you can call our care managers and care coordinators. We will get back to you with the latest update very soon. So whatever we have, we'll let you know through email, through newsletters, through WhatsApp messages. We'll get back to you with whatever update we have.
Can
on
we
the
have a
website.
minute of this
Alka,
meeting? Can we have the minutes of this meeting being mailed to us?
Sure, we can do that.
And can I ask one last question? I don't know if Jayantada is still on or Pradeep. Is there any plan for Tribeca to vaccinate like all of its clients as a sort of almost like a mass vaccination of Tribeca's
No,
clients?
and that's what Jayantada mentioned, is
Mhm.
that he's been in touch with certain government officials to see that whether we can get large cohorts to do it together on a certain day in a certain location.
Mhm.
But we are still yet to hear from them.
Okay. But if that is a possibility, please definitely, of course, let us know.
Absolutely.
Yeah. Okay. Thank you so
Pradeep,
much.
I've left my
Thank you
email
so
in the-
much.
Mr.
It's a
Pratik,
very
Yes,
nice
please.
program
Small
and
question.
very knowledgeable. Thank you so much.
I've
Thank
left
you.
my
Pratik.
email.
Yes, please.
Yeah,
Send us the minutes of the meeting
Please
and
send us the
summary
summary.
kind of stuff for the meeting so that we can know all of them if we have missed something or in the process.
Especially
Very
what the
good.
doctor said. I mean, that's very important.
Yeah.
Please send us the
That is
summary.
important. Yeah,
Yeah.
do we, that small quick, do we have a choice to make, though we are not the right person to make the choice, but do we have the freedom to choose which one we want to opt for, either Covishield or the other one?
So we answered that question,
Yeah.
and I think the answer is no, not yet.
Excuse me.
Okay.
I think there's one gentleman who's trying to ask something. Mr. Oshit Paul, I think he's trying to ask. Can you get back to him? He's been trying for quite some time now. I think
Mr. Oshit Pal, please unmute.
I don't think he can unmute his. Yeah. Thank you.
Yes.
Please, sir.
Can you hear it?
Yes,
Can you?
yes. We can hear
Just
you.
I'm asking on that I have a comorbidity, brain tumor. Can I take this vaccination?
You
Of
can.
course, sir. As the doctor said, anybody with comorbidity and who is above 50 will be under the next phase who will be vaccinated. So of course you can get vaccinated for COVID-19.
No, but then with the brain tumor or something, I think a doctor
Yes.
needs to be consulted.
Yeah, of course.
I've left my email in the Tribeca Care in the chat box. If you want the document, I can email it to you if you provide me the email address.
We'll do that. We'll do that.
We have shared our email address, sir, in the chat box.
So why don't, we'll do that. So very good. I think let's bring this to a close.
Yeah.
And if you have any questions, any very particular questions, just write to us, talk to your care manager, and we will help you the best we can.
Thank you so much.
Are you going to send the recording of this? Are you going to send the recording of this meeting?
Yes, ma'am. This webinar is will be on Facebook. We will share the recording with you also.
Thank you.
Thank you.
Thank you so much for joining us.
Thank you.